you soon.
Yeah. Good morning, everybody. I'm so excited to be in Corpus today. My name is Cornish, and I'm the director of the Area Agency on Aging in Victoria, Texas. I'm very honored to be here. Thank you so much, Elsa, for inviting me. Today we're going to talk about waiting lists and some options that providers may have to address their waiting list and to provide additional service in their communities. If you didn't intend to be in this session, feel free to get up and walk to the next one if you don't know about meetings at all. Okay. For the last several years, Elsa and Betty and I have been advocating to the state office to develop a statewide policy that would allow providers to initiate private pay meal programs. It took a long time. We pounded the door for years, and we finally were successful in convincing the state to put out a policy allowing the practice of private pay meals. I got to turn you on right now. Sure. So, private pay programs are allowed in the Older Americans Act, which it's very important to know what the basis of it is, so that you know that you're doing the right thing and that everyone supports a program of this kind. So the Older Americans Act provides for it, allows for it, and now we have an official technical assistance memorandum from the state that also allows for the provision of private pay meals. I have these resources for you. I have this little PowerPoint for you. Feel free to take whatever notes you'd like. I do have the resources for you. I can give you a minute. So the policy that was established by the state allows for private pay in congregate, home delivered, and transportation. The real key to providing and establishing a private pay program is to establish clear distinctions between this program and the one you're providing under Title III. You just need to have it in your mind that these are two separate, distinct programs. They're like distant cousins. They don't see each other. They don't talk to each other. Once a year, they might come to a reunion, which is the budgeting, the rate setting stuff. But any other time, they are completely separate. So, with that in mind, you have to establish an accounting procedure locally within your organization to account for the cost and the revenue that will come to you as a result of private pay. So you have to establish some codes, work with your local accountant or your bookkeeper to make sure that you have a clear line in your accounting records that points to the private pay revenue you receive and the expenses that are associated with providing it. And those expenses, that's going to mean coding some of your food costs, your delivery costs, your labor costs to the private pay program. All of the expenses that you have on the Title III side, you're going to have those same expenses on the private pay side. And there has to be an allocation method in place to do that. The fee and the meal cost. Private pay consumers pay the full cost of the meal. Okay? You're just charging them. The meal costs $6.25. That's your whole rate that was probably, could be an example of a whole rate that came out of rate setting. If your whole rate for a home delivered meal was $6.25, your private pay customer should pay $6.25. They don't have the option of making whatever donation they can afford to make. If they're going to be on a private pay program, there has to be this understanding that it's going to cost. It's like going to the cafe. Your meal costs $6.25. Okay. There are nonprofit, and you don't want anything about a private pay program to jeopardize your nonprofit status. So before you start, as your process of developing it locally, you may consult with the lawyer, maybe you have a legal counsel that's available to your program, maybe somebody that's on your board, just to let them look over the process and make sure that you are not going to jeopardize your nonprofit status by providing this. And usually, you know, I'm not a lawyer, and I'm providing this caveat because it was given to us by the National Association of Area Agencies on Aging as this private pay issue started to unfold, that if you make too much profit on private pay, that excess business income could impact your status. So there's an issue there that you need to discuss with your legal advisor. And you may not have to pay for that advice. Maybe you have someone associated with your organization that can give you an opinion one way or another. The rate setting. Private pay programs have to be included in the rate setting so that you are developing a true full cost budget. But it's included in a column that says other, I think it's called other non-DADS programs or something like that. There is a column in the Title III rate setting process that will allow you to accumulate those costs and those revenues for a private pay program. And that's the only time, like I was saying earlier, that these two programs really come together in any way. We need to talk about program income, because we're all kind of used to, you know, the participants make a donation, that's all private, that's program income, and we're receiving it as program income, we're reporting it to the AAA as program income, and we're very careful about program income, making sure that it's, you know, confidential and that sort of thing. And then when the AAA pays providers, it accounts for the program income you've received and then pays you Title III. So there's this tracking of program income. Well, the good thing about private pay is that the money they pay for the meals is not considered program income. So that's your own separate resource. It's not reported to the AAA. It's not considered program income. It wouldn't like come off the top before Title III payments are made. So that was an important distinction that we wanted addressed at the state level, so that there would be no confusion about the revenue that's coming from these meals. These meals are also not eligible for NSIP. That's the Nutrition Service Incentive Program, right? And that's a funding source that comes through the Area Agency on Aging. And so that's NSIP funding comes to the local area based on the number of meals that we serve. And those are the meals that you report to the AAA, to the Area Agency on Aging. You're not going to be reporting private pay meals there. Private pay meals are not eligible for NISP funding, so that's why they cannot be reported. In a private pay system, there has to be pretty specific and regular staff training. So everybody understands and knows who's a private pay client. You know, when that payment comes in from their daughter, that it's not received and put it in with program income. Everybody has to understand that we've got another program now, and it's completely separate from this Title III program, and so that they know how to bring those payments back to you and how to treat those meals. There may be a segregation of whatever client files you have that pertain to private pay customers. Again, it's at the heart of a private pay program is the segregation in the accounting and the budgeting procedures of the individual provider, establishing codes. There has to be a billing process. You're going to be billing people for their meals. Just a clear delineation of the private pay from the other programs that you are providing. A private pay meal does not have to meet the DRI compliant menus. So it does not have to meet the dietary requirements that we all follow for our Title III program. If you choose to offer different meals to private pay individuals, you have to ensure full accountability for the cost to prepare the meal. So if you're serving something maybe that might be more expensive to a private pay or in some way deviates from your full cost, you have to have documentation and be able to justify why that is. But as far as the menus are concerned, you do not have to comply with DRI menus. I would imagine for cost effectiveness that you probably would. I mean, I can't imagine somebody not using the menus and cooking the food you're already cooking. That would just create, if you served another menu, that would just sort of defeat the purpose of economies of scale and that sort of thing. But you're not required to meet those requirements, those dietary requirements. When the state developed this policy, they had it in mind that it would be implemented for new customers. That we wouldn't take existing customers off the roll, so to speak, and tell them, okay, now you've got to be a private pay customer. So they expect us, or they have strongly encouraged us to apply the private pay policy to new customers. So now, instead of saying to, Mrs. Smith is calling about her mother, she needs a home-delivered meal, all the slots are full, we have no money to provide anymore, there's a waiting list, now you have another option to offer her. Our subsidized slots are full, but we do have a private pay option. Would you be interested in that? And she might be very willing to pay for meals for her mother if she knew that that option was available to her. So there you go. There's a private pay customer, and it sort of alleviates the stress on your waiting list. Now, part of your local procedure will involve giving a private pay customer the option to stay on the waiting list. If they want to stay on the waiting list until a subsidized slot is open, they can be given the opportunity to do that. So you can add them to your waiting list, and then when slots open up, you have a process where you look at everybody who's on the waiting list. You can pick the people who best meet the targets, the targeting criteria, and people that are most needy. It may be that Mrs. Smith's mother just rises to the top of the waiting list, and when you have a slot, she comes on to the subsidized meals. I provided a sample of a targeting criteria for you, but you may already have one in place that you can use. But when you put the private pay customer on the waiting list, they should be treated just like anyone else who's on the waiting list. There shouldn't be some separate little note here, well, families paying private pay, so that really their name just stays there, but nothing ever happens. They're never considered. So when you have a waiting list, everyone should be treated and regarded equally. Okay? Let's see. Oh, let me point out also, if there is a regional funding formula, if you have a funding formula that includes some performance like meal served in the calculation of how much money you might receive during a year, I don't know if that's done here. So in some places it is. But if there is a regional formula for Title III money, these private pay meals should not be calculated into that formula. These private pay meals, again, are separate. Okay. Oh, yeah. Here's the advantage of it. No intake forms, no waiting list. It's open to all ages. If you get an inquiry from maybe a mom of a disabled child or someone who is under the age of 60, we're kind of used to operating and providing service to people over 60. This is open to all ages. And of course, we talked about the menu requirement. The procedure that was issued by the state recommends that it be applied to new customers, like I said. However, there is a provision to transition current clients to private pay. And there may be instances in which that might have to happen. Maybe some small congregate site is having a hard time staying in business. And they still want to have their meals there, but they're just having a hard time going. And they decide, well, we would pay for our meals if we could. Can we just have the meals that we pay for them? Well, that congregate site might turn into a private pay provision location. And then the type of crews would transition to private pay. But that private pay transition to current clients has to be done in close tandem with the area agency on aging. You have to have a lot of conversation with Betty and the staff at the AAA to take current clients off of Title III and put them on private pay. Some payment mechanisms that are being used around the country include checks, credit cards, PayPal. Most of the private pay websites and programs that I reviewed over the years provided for payment through their website. So there would be a little link there as private pay. You click on it, put your information there, submit your payment. There may you may be able to create like an automatic draft from the bank if they would choose to do that. But those are all things you can consider when you get right down to it. So the takeaway from what I'm telling you today is that you can start a private pay program. You must pay, the private pay consumers must pay full cost. You have to develop a little plan before you get it started, and I'm sure Betty will work with you, and our staff will work with you to have that little procedure in place. And you have to have clear accounting records. Don't have to be DRI compliant menus. And the reporting to the AAA is very minimal. We do all vendor service in our area. It's all vendor agreements as opposed to subcontracts. So for us, vendor agreements, we wouldn't even collect those intakes. They wouldn't even send them to us. We wouldn't put them in the SAM system, in our client information system. If you have subcontracts, that would be up to Betty. I think there's a care program in SAMS is called non-NAPIS, but whether or not she wanted to put those in that system, that would be completely up to her. But in my area, I would have no need to know about private pay consumers until budget time, and then we would just be talking numbers. Let me give you the resources, and do you all have any questions?
Are there any existing programs and providers doing private pay at this time that you're aware of it?
Well, it's Brazos Valley, so one of his vendors is doing that.
Yes, with the college in Morton, I think.
I think the trickiest part would be the accounting, including it separate.
But it's good that we have the state support for it,
Yeah.
so that there'll be no misunderstanding for monitoring purposes and that sort of thing. We wouldn't be monitoring private pay programs.
What happens if private pay meal at the end of the month or they won't pay?
That's part of a policy too, that you should put in there that if we don't get our payment in 5 days, then the meals are just
Cut off.
cut off. Cafe wouldn't serve your meals if you didn't pay for it.
I guess when you're developing your budget, you have to consider that. Probably something.
And we consider being, paid ahead. Paid ahead.
Pay ahead, yes.
That's right, paid ahead.
Yeah. I'll leave these other bags with you in case somebody would want these.
Okay, yeah, sure.
So if any questions come up after today and as you're looking through the program, Betty and her staff are available for you. And if there are questions that we can't answer, we have a help desk up at Dennis, and they'll be glad to help us with any questions that we might have.
How long has it been in place that it passed through all the processing and is approving?
February the 22nd was of this year, February the 22nd of 2013.
Is that right?
So I put the technical assistance memo in your material, so you would have that for your files too.
Thank you, Cindy. We appreciate it. And certainly thank you and Betty for championing this cause, because I know you get calls from us saying, we've got people on the waiting list and people are wanting to pay. I mean, what do we do? And so now it's on us to set up the process and the policies and the accounting system to be able to do this and have that as an option for those people in the community that are wanting, something for their loved one, especially the families of caregivers. Another thing that we have in place in Corpus Christi that we've been doing for a while, and one of the things that really resulted out of something that Pat said earlier in her session this morning is the friend raising. And in a relationship building that we've done with the local car dealership, it's Lydia Carson Jeep Dodge in Corpus Christi, they came to us and wanted to do something. They wanted to involve their staff in some type of community service project. It's on a national level they do this, and they're set up in regions. So they wanted to get involved in the community, and they liked, of course, Meals on Wheels. We said, you don't have to sell Meals on Wheels. People get it. So they came to us and wanted to know what to do. They helped us with a turkey leg fundraiser. Those of you that have been on staff remember the turkey leg and rubber sale, a bizarre thing that we did for a couple of years that were very time consuming and gave us $500, so maybe we could do a meal for a month. But anyway, ended up really evolving into a long-standing relationship for involvement with our senior pageant. We have an annual Miss Coastal Bend senior pageant, and the general manager is our MC, and he's like a champion for senior services. But he also really believes in the Meals on Wheels program and got out on a cool Corpus Christi fan drive delivering fans. Also the March for Meals that comes out of the Meals on Wheels Association of America every March. They have a March for Meals, a Mayor's for Meals, and goes out and delivers meals. So he sees firsthand, the clients that we serve and understands their stories. This past March we went out and he went to a home of a widow, and she's having problems with her home. And afterwards she said, I think I can get a crew of my staff and we can help her by fixing whether she had boards on her windows and things like that. So helping clients, going the extra mile to do that. But the other thing that has been a long-standing project of theirs has been the Adopt Meals on Wheels client. And they actually pay for the cost to fund 2 clients per month. And they've been doing it, let's see, last year was 18 months, so probably 3.5 years, they funded the full cost of these 2 clients. So it's not separate like this, and they have to meet the eligibility requirements, but it's a way for us to take off people from the waiting list that we had, which we've never had before in the history of our program. But in 2011, when our city reductions came into place and finally affected senior programs, not just in senior centers, but also in meals, we had to establish a waiting list. And at the very beginning, we had like 188 folks on the waiting list. We had to just stop putting people on the program and start putting people on the waiting list. And that's when we started getting those calls even more frequently saying, I'll pay, I have the money, I can pay, just let us know. But we have Lydia Crescent Dutch doing the adoption of 2 clients, and then we also have, since then, we put it on our Facebook page, and we haven't done a whole lot of advertising on it, which probably should do more, and now with the information we've learned, y'all can help us, do staff, take it to the next level, and promote this opportunity for the community to get involved in the adoption process. And we have a church that has funded 2 clients for a year, and then we had another church who, they just gave us the money. They didn't say we wanted for the adopted meal, but they did, for the last 2 years in a row, during the Lenten season, their club, their group, that means it's a senior group, and they meet, and they, instead of going out to eat once a week, they put that money that they would spend into a fund, and at the end of the season, then they write us a check, and they say it's for the meals, for someone. And so, it could be 1 person, or it could be 2 people, however, nets the full donation of what they provide. You have a question?
Yes, ma'am. What does it cost to fund, to sponsor a client?
We had 582 was this year, and then 612 last year. So we're waiting for this year.
You get that right off the rate setting.
Yes,
documents,
right.
The whole rate.
The whole rate, yes.
So that's permanent?
Yes, no, per meal. So we just say, with Lithia, we invoice them afterwards, because we figured they're good for it. So we invoice them. And there have been times where they've missed a month, and then we just invoice them for the 2 months, and then they send us a check. So that's pretty, and it comes from their corporate office, so it's not even the local office. I think we've been, this year we transitioning to get the checks from the local office, so that's going to be.
That costs about, what, $120 per person per month? What is the average?
582 times, we say it's about 21 meals a day.
A little over.
Yeah. So yeah, it's about 1,120 a year or something like that, because what those people have done. And there was one church who did it for the year, and they actually wanted to know they could do it in honor of someone, one of their members, who used to be a member of a senior center, but had declined in health, and then was, very active in her church as well, and they did it in her honor while she's, still living, and so that's a tribute, to her. And so we do have copies of the letter. We have copies of our correspondence with people who are interested. We can certainly provide you with that. Just give me your email, your card, and I can certainly email you those documents, and you're free to edit them as you wish. And so, do you have any, I guess you or the other people from other communities who might have another option for what you're doing with your waiting list to try to decrease your waiting list? Do you have a program in place?
Yeah, I have about 30 clients in the waiting list. But we're going to be getting some money from the county to take care of it.
Oh, really?
Hopefully.
So you just did like a grant request for
Yeah.
to support additional meals?
I'm from Cornish.
Cindy, you said you had a targeting document.
Yes, I think it's in the back.
So you just don't put people on the list arbitrarily. You look at their scores and other factors before you decide who comes off the list.
And that's how we're doing it too for our waiting list, is prioritizing, the most in need. And we've had a little more flexibility this year with, we're getting the waiting list down, and have spoken with discharge planners at hospitals saying we will take emergency cases and place those people on until we can either transition to the adopt annual program, or if there is, of course, by attrition, take the place of someone who's come off. A lot of that recently. Okay. Other than that, any other questions?